नमस्कार, सत श्री अकाल, आदाब, गुड मॉर्निंग, गुड आफ्टरनून एंड गुड इवनिंग जहां से भी आप हमें सुन रहे हैं. थैंक यू फॉर जॉइनिंग आवर लाइव सेशन. माय नेम इज कुंजन मवार. हमें आपके होस्ट और दोस्त फॉर टुडेज एफपी सेशन. These are unprecedented, unpredictable times. If you are Indian origin folks living in US, and if parents are visiting from India and you are looking for medical consultation, well, look no further. eGlobal has your back. Access to doctors from USA and India. Their specialties include but not limited to internal medicine, cardiology, orthopedics, oncology, pediatrics, and many more. Prescription will be provided. Response time is 1 to 3 days. Family members can participate via live video physician consultation from any part of the world. Video consultation is up to 30 minutes. In-app messaging with doctor after consultation, ID and portable health passports. In today's Facebook Live session, we will be exploring and providing more information about chronic obstructive pulmonary disease with Dr. Raj. Dr. Raj is a pulmonary and critical care physician in Pittsburgh. Completed his medical school from Gandhi Medical College in Hyderabad and joined residency in internal medicine at UPMC. Interventional pulmonary medicine, asthma, COPD, pneumonia, lung cancer, ILD, sleep medicine are his area of expertise. Welcome to eGlobalDoctors Facebook Live session. Thank you for taking time from your busy schedule and educating us. How are you doing this evening, Dr. Raj?
I'm good, Kunjan. Thanks for having me, and really appreciate this platform for having me, and taking care of patients, having these discussions. This is very helpful in these times.
Well, thank you so much. So with that, I'm going to start with our questions. Are you ready?
Absolutely. Shoot away.
Okay. So COPD. What is COPD and what are the different types of COPD?
Sure. So COPD, it stands for short for chronic obstructive pulmonary disease. So it's something which is very common, very preventable and treatable. Typically people have persistent symptoms, like respiratory symptoms, and is due to exposure to smoking or some of these noxious particles, gases, fumes, you name it. So the way to think about it is just a little bit of, if you think about a lung, it's like a balloon, right? So lung is like a balloon, and there are these smaller balloons inside this big balloon. Typically, when someone inhales air or oxygen from the atmosphere, that oxygen gets through the pipes, through the tubes, into these small balloons inside. That's where oxygen diffuses from the lung into the blood, and carbon dioxide gets out of the blood into the lung. So oxygen gets in, and that gets delivered to all the vital organs. So if anything goes wrong with the lung, oxygen cannot get in, carbon dioxide cannot get out. So that's the typical function of the lung. So to look at the types of COPD, bottom line, there are two. One which is clinically based, and that's called chronic bronchitis. So it's a clinical diagnosis where a person has been coughing, bringing up phlegm. And this is on most days, approximately 3 months in 2 consecutive years. So if this is someone having these symptoms, we call that as chronic bronchitis. Versus the other one, which is called emphysema, is more pathological diagnosis. So, or sometimes even on a CAT scan, someone can pick up emphysema on that. So here, the diagnosis is that the air spaces, the balloons, the small balloons we're talking about, those are abnormal. They lose their stretchability. The balloon, once you keep blowing, it loses that stretchability. The elasticity is gone. So the walls of these balloons get destroyed, and therefore that results in what is called as emphysema. So although these are the two different types, sometimes they may coexist, and they're treated the same. They are due to the same risk factors like smoking. So they are lumped together as COPD.
Okay, so 2 kinds of COPD we know. So you mentioned the word bronchitis. Now, this is allergy season. So sometimes, bronchitis might flare up because of allergy. So how does one distinguish between if I have bronchitis of COPD or this is my allergies?
Very good question. So, so the way to think about it again is, if you are looking at asthma, which can be exactly the same. So there are different triggers. For example, asthma occurs with seasonal variations. Sometimes when the pollen are heavy in the atmosphere, or there are a lot of fumes, or sometimes it may be infections. So those would be typically in that particular season. The seasonal bronchitis or seasonal allergies would be related to a particular season. Sometimes it may be the hot, humid weather. Sometimes it may be the cold weather, which kind of causes these airways to kind of narrow. So if it is related to a particular season, then we can assume that is seasonal allergies. Versus if this is something which is more progressive, not a particular season, but it is ongoing, most number of days, over a 3-month duration, and this is happening every year, that would be the bronchitis.
Got it. So if it's allergy season and something like this happens, it's most likely it's allergy and not to worry about it.
Exactly.
Okay.
Yep.
Perfect. So you did touch upon it, but if you can elaborate a little bit for our viewers, like what are the symptoms and causes of COPD?
Sure. So if you look at the easy way to think about it, so first of all, COPD is a heterogeneous disease, right? So it's some people present with cough and sputum production. Some people, it may be dyspnea. Dyspnea is shortness of breath. So they get winded easily. They may be initially when they are walking uphill or climbing stairs or carrying something heavy, but eventually that may start progressing. They may notice some sounds coming up from their lungs, like wheezing, what we call as, right? Significant mucus production. So these are all typical symptoms. And the way to put everything together is, so say there is any injury. So say someone cut their hand, right? It causes inflammation. So the body tends to react to it by accumulating cells in that area, which stop the bleeding, which fight the bacteria and heal that area. Same thing when there is a foreign body, whether it may be smoke, any particles, when someone inhales that triggers an inflammation in the lungs. So the lungs produce enzymes which try to destroy these foreign bodies, these fumes or particles or smoke or whatever it may be. And in that process, those enzymes can also cause damage to the lungs. So the lungs now are not able to participate in that gas exchange we were talking about earlier. So that inflammation triggers mucus production. So all these symptoms are related to inflammation in the lungs, which the body is trying to fight, right? So other than these, what are the causes? Of course, smoking is the major cause of COPD. But there are multiple other things, like asthma itself could be one of the risk factor for someone to progress into COPD. Occupational, certain types of occupation, when they're exposed to dust and fumes and acid or whatever it may be, they can be causing COPD as well. Some genetic abnormalities, there are deficiencies of certain enzymes which could be contributing to this. Recurrent infections. So there are 100 different things which could be related to COPD. But predominantly, 80% of the times, it's smoking related. It's either direct smoke, secondhand smoke, whatever type of smoke, that's the most important cause.
Okay, perfect. Thank you. That's a real eye-opener. So thank you so much for elaborating on that, Dr. Raj. So if a certain human being has COPD, how does COPD affect our daily lives?
So what we look at is the three major things, right? So shortness of breath, cough, and sputum. So if you think about these three, the way it limits a person's activities of daily living is what we call that as. So physical activity. So the person is not able to walk for long distances. They get winded. They have to stop. They're not able to do daily chores. They get deconditioned because they're not able to exercise. So their lower extremities, the strength, they start getting weaker. They're not able to walk uphill. They're not able to lift anything heavy, carrying groceries, or carrying their laundry basket from the basement. So these are things which physically they get challenged with. But this happens, now they are socially, they're not interacting, they're staying at home, away from people. They start getting anxious, they start getting depressed, their mental health is affected. They slowly start losing the pleasure of activities of daily life. Sleep gets affected. There's kind of like an overlap of COPD and sleep apnea. So they're not able to have a good, refreshing sleep, which in turn affects other vital organs, blood pressure going up, irregularities of the heart. So these are kind of, in general, how it starts affecting. And also socially, they're trying to avoid people because they're constantly coughing. They don't want to be seen coughing. They have to have oxygen. They don't want to be, they're not impressed to wear oxygen and come out, right? So they feel it as a taboo. People will think differently when they look at them. So that's how it kind of affects their daily life. It's unfortunate. So that's why it's extremely important to understand and try to treat them as quickly as possible. I hope that answers.
So,
yeah.
No, wonderful. So if I have to boil it down, so a person who is not able to do regular chores, like you were saying, lifting the groceries or walking a little bit, not able to sleep properly, not able to socialize, anxiety, depression. So those are basically the common ways how a COPD can affect a person's life.
Absolutely. Yep. You're absolutely right.
Okay, perfect. So does it also affect on somebody's life? Like, what's the life expectancy of a person suffering from COPD?
I won't go too much in detail, but COPD has different stages, and what we try to do is there's a specific index which is called BODE index. It's BODE, where the acronym B stands for the BMI, the body mass index. So if someone is very thin, very frail, that scores a point. That's bad for them, right? If their BMI is more than 21, that's good for them. So in the board, the B stands for BMI, O stands for obstruction. So how bad is COPD? So we ask them to do a breathing test where they blow into a machine, and we look and see in that first second, how much air are they being able to expel out? What is the lung capacity? So based on that, we grade them as mild, moderate, severe, or very severe. So that is the obstruction part. And then the dyspnea, or the shortness of breath, is what we talked about. Are they comfortable when they're walking or exercising? Do they only get short-winded when they're walking uphill? Or is it even on level ground? Or even if they have to dress or shower, they start getting winded. So those have different points as well. And then last is their exercise capacity. E is the exercise capacity. Are they able to walk 100 yards or 150 yards? Yes or no? And if not, then they score 3 points. So bottom line is, anyone can score anywhere from 0 to 10 points on this BODE index. So if they score very high, if they have 10 points, that means their 4-year survival is very dismal. It's less than 20. It's about 18%. Versus if they don't score any point, if there is 0, if they are really good, or 0 to 2 points, that means they have excellent life expectancy. They're more than 80% survival in 4 years' time. So that's kind of how we use. There are other complex things to use too, but these are some of the simpler ones.